Go ahead.
Hello, everyone. I'm Donna Lynne. I'm the Senior Vice President and Chief Operating Officer at the Medical Center campus, but also the University COVID Director. But I'm joined by a team that we all work together to try to help set COVID policies, to answer your questions, and to keep you continually informed. You will recognize this group because I know many of you have been on previous webinars. You're going to hear from Dr. Wafaa El-Sadr about some of the COVID data in New York City in particular, from Dr. Melanie Bernitz about some of the compliance issues that hopefully are well underway and hopefully also met by almost all of you. I'll talk a little bit about a recent change to New York City law with respect to vaccinated individuals and the requirements to access certain dining, entertainment, and fitness venues. And then we have 3 other panelists who are here to help answer questions, Julie Kornfeld, Gerry Rosberg, and David Greenberg. We had a number of questions submitted ahead of time that we'll be tossing to all of the panelists. And also, if we don't get to your question or there's something that occurs to you as we're talking, please feel free to email the address that you use to actually register for the webinar. We'll be able to pick up those questions and we'll update our FAQs and the COVID-19 website. And just to repeat, I know we get a lot of questions. Many of them are already answered through the COVID-19 website, and the FAQs are a great guide to help everyone find the answers that they need. So with that, I'm going to turn to Wafaa and ask her to set the context for what's going on in New York City.
And thank you very much, Donna, and let me share slides, please. It's I'm having trouble. Maybe you want to go first, Melanie, while I work this out?
Sure. I will get mine ready and let's hope mine slideshow from beginning.
Melanie, I could share yours.
I'm here, I think.
Okay.
We good? See mine, right? Great. Okay. Good afternoon, everyone. Thanks for joining us. We'll just reverse the order here. So I'm going to give you the more Columbia context, and then we'll go back to Wafaa for the global context. So hopefully you've been continuing to look at our COVID-19 dashboard where we update the weekly numbers. You can see last week, which was a shortened week because of the holiday, we did just over 8,500 tests. 25 of those were positive tests. It's a 0.29% positivity rate. We have remained consistently under 1% on our on-campus testing. Our random surveillance testing was there as well, 0.2%. And we did have 58 tests reported from outside testing as well last week. About 69% of the tests that were done last week were gateway tests, and the positivity rate amongst that group was 0.15%. So again, certainly continuing to detect the cases and then do the contact tracing as we need to. Just to show you where we are right now, we are remaining in our yellow zone defined as low risk, and this just summarizes the measures that we're taking. We're continuing to do the mandatory weekly testing of anyone who is unvaccinated with an approved exemption, or of any individual who is just still in process of completing their vaccination. We continue with the random sampling of all vaccinated affiliates and the wastewater surveillance, which is covering about 90% of our undergraduate residential buildings. We get wastewater surveillance 3 times a week, and then targeted testing on those individuals if a spike is detected. Just as a reminder around our face covering, masking indoors is required by everyone, regardless of vaccination status. And unvaccinated individuals are masking both indoors and outdoors. Indoors, vaccinated individuals do not distance, and outdoors, again, they're not required to mask or distance. Our gatherings are still limited outside of the academic, which has no thresholds, with the numbers that are shown here. And there is a university travel policy in effect, and that can be found on the COVID-19 website. So just a reminder in terms of the deadlines and the checklist, some of these dates were updated. We obviously passed the deadline in August for complying with the university's vaccination requirement, but effective last week on September 9th, the Red Pass was integrated with Lynne Swipe for anyone who is not compliant with the vaccine requirement, meaning that they are unable to access campus. This week's a busy week because we're ensuring that everyone is up to date with the remaining requirements, which is signing the compact, completing the training, and ensuring the gateway testing requirement is complete. And that will be integrated with the Swipe access as well. So just a reminder around gateway testing, this is for anyone who has not accessed campus this calendar year. It is the first test that is done on campus. It has to be done at one of our testing sites, Lerner Hall, Black Building, Tarrytown, or West 51st Street. We have now passed these dates. So basically now starting next week, anyone who's not done this will have a Red Pass and will be required to complete that test before access. We do ask anyone who's unvaccinated or partially vaccinated to remain off campus till they have the result of that gateway test. Those tests must be scheduled. We have been very, very busy. Obviously, you've seen the volume of tests, but actually there are tests available later on this week. So we've seen kind of that ease off in terms of how busy the schedule is, but those are appointments required. The schedule for testing appointments opens about 7 to 10 days in advance and has to be done through the Secure Health portal. And then again, the ongoing surveillance testing is required for everyone to continue to participate. And a failure to participate in your required level of surveillance does lead to removal of the checkbox on your app around testing, which then leads to a Red Pass. And as I mentioned before, anyone with an approved vaccine exemption has weekly testing. The vast majority of our population is vaccinated and will get called for random sampling. Participation, if you are selected, is required. As I mentioned, you get given a window of time within which to complete that testing. And if you fail to do so, again, that checkbox will be removed and you will be blocked from accessing campus. This is true for faculty, staff, and students. And I did want to just review quickly the quarantine and isolation and just redefining these words again. These are things that our contact tracing team works on. Quarantine is what is required for an individual who is either a close contact or a travel. This is not for someone who is diagnosed with COVID-19, but someone who may have been a close contact. And this guidance around this has changed with vaccination. There's obviously a travel requirement for unvaccinated individuals arriving from international locations, and that's defined here. But in terms of quarantine, so for example, if there is an exposure in a classroom, in a social setting, it's only required for unvaccinated individuals who are defined as being a close contact of an individual with COVID-19, and they're required to quarantine for 10 days after their last contact with that infected individual. If you are a close contact of an individual with COVID-19 and you are fully vaccinated and have no symptoms, you are not required to quarantine. You are merely required to test on day 3 to 5 after the exposure and monitor for symptoms. So that's been a real change and it's really impacting the return to campus when we do have cases, because with the majority vaccinated, the majority are not required to quarantine when they have a close contact. Isolation is what is required for anyone who is diagnosed with COVID-19. And an individual who is diagnosed with COVID-19 is required to isolate regardless of whether or not they have had a vaccine. And that isolation period is 10 days long. So there's no difference in the isolation for anyone who is diagnosed with COVID-19 based on the vaccination status. That is the big difference. So students may be missing class, or faculty and staff may be absent from work if they are diagnosed with COVID-19. Similarly, an individual with symptoms who has been tested and is awaiting results isolates until those results are available. The difference is a close contact who is vaccinated and has no symptoms but is tested after a close contact does not have to isolate while they are awaiting those results. So it's important for us to understand the differences between isolation and quarantine, the groups that fall into each one, and the big difference that vaccination has played in the requirements for isolation and quarantine. I'm going to leave it there and turn back. We'll see if Wafaa is able to share, and hopefully that addressed some of the questions that did come up regarding when students may be absent from classes. You're good, Wafaa. We see it now.
You have to come off mute, Wafaa.
Yes, I am. I'm going to give you a very quick update on where we're at in terms of the COVID-19 pandemic. So I start with the slide, which I want to remind everybody that the situation now, at least in this country and in other countries where there's been substantial uptake of vaccination, is that vaccination really is a game changer. And you can see this on the left. This is a map of the United States with the darkest areas of red or maroon color are parts of the country where high rates of average cases per 100,000 population in the past week. So these are areas that we call hotspots. On the right-hand side, you see a map of the United States that looks at actually the percent of residents who are aged 12 and above who are fully vaccinated. And the darker green shows parts of the country that have the highest rates of vaccination. And you can see that in parts of the country, for example, the Northeast, where we have higher uptake of vaccines, these are the same parts of the country where we have lower numbers of cases recently. So what about what's been happening in New York City? I think when you, just very quickly, you recall that we had that initial terrible surge, the first surge last year in March of and April of 2020 last year. And then we have here the numbers of cases that you can see, and particularly this latest surge here that we're seeing that's in the context of the Delta. And you compare that with what we saw earlier this year in the winter months when we had a more substantial surge before Delta. You can see that our surge now is at a lower level than we saw earlier this year. And then if you look here at the recent data in New York City in terms of numbers of cases, you can see that thankfully we are seeing a substantial decrease in terms of numbers of new cases per day. Similarly, also, when you look at the numbers of hospitalizations in New York City, you'll see again recently now, we're seeing a substantial decrease in terms of hospitalization. This is in the context of the Delta variant predominance in the city. And then another metric that's very important is measures transmission rates in New York City. And here we also have good news. This measure is you take into account the total numbers of cases per 100,000 population in the last 7 days. And these are the data here over time. And in the darkest blue is the transmission in New York City, is citywide overall. And you can see that, again, we're experiencing a decrease in transmission numbers of cases. And this has been being experienced in all of the boroughs of the city, including in Staten Island, that have the highest transmission rates in our city. So overall, the news is good in terms of everything is moving in the right direction in our community. I wanted to share with you quickly some data on the effectiveness of vaccination in terms of COVID-19 cases during the period when we have a rise in the Delta variant in the United States. This figure here shows over time from May to June, July, in terms of numbers of cases, this one in terms of hospitalizations, and this one in terms of figure in terms of deaths. And in the lighter blue are amongst those who are fully vaccinated, versus in the darker blue, those individuals who are not fully vaccinated. And you can see here the dramatic effect of vaccination in terms of prevention of hospitalizations contrasts what happened with Delta amongst those who are unvaccinated versus those who are fully vaccinated. And also in terms of deaths from COVID, again, flat curve for people fully vaccinated versus those who are not fully vaccinated. And this again demonstrates the effectiveness of these vaccines in terms of particularly hospitalization and death, but also in terms as well of prevention of cases of COVID-19 in the Delta era. And similarly, we've seen from New York State similar data that look at hospitalizations. This is all of New York State. And the bottom here, solid line, are hospitalizations per 100,000 fully vaccinated individuals. And you can see the flat line even during the Delta era compared to others who are not fully vaccinated or unvaccinated individuals. And then we have similar data from Los Angeles County, and I'm focusing just on hospitalizations here. And again, you'll see over time during the Delta era, you can see again the difference between the rates of hospitalizations for COVID per 100,000 amongst people who are fully vaccinated versus those who are unvaccinated. So we have pretty convincing data that our vaccines seem to work and work well in prevention of infection, but particularly in prevention of hospitalizations and death due to COVID and due to COVID with Delta variant. Quickly, this is just New York City. I just want to show you again, even in New York City, we're seeing the difference here in terms of hospitalizations among the vaccinated versus the unvaccinated, and similarly, the difference in terms of cases overall in New York City amongst the vaccinated versus the unvaccinated. I wanted to just add one. We often get a question about the what about vaccination and long haulers or long COVID? These are people who have long-term symptoms or symptoms that last for beyond several weeks from COVID-19. And we do have interesting data and actually reassuring data also in terms of the effect of vaccination in terms of development of long COVID symptoms. And you can see here in this figure here on the left, in red are people after the first dose, and in blue after the second dose. And you can see here in terms of symptoms lasting more than 28 days, which fits the definition of long COVID, that we are seeing that for people who've been fully vaccinated, there is protection. It's less than 1, which means that vaccination appears to protect against the development of long COVID, which is really good news amongst young people and also amongst older individuals, younger individuals and older individuals. So that also is reassuring data because we often get asked, what do the vaccines do in terms of prevention of COVID, of long COVID? And quickly, I think I've mentioned this in a prior webinar as well, is that over time, we are moving from a pandemic phase of this of COVID-19 in areas of the world like New York City, where we have high uptake of vaccines. We're moving to an endemic phase where our goal is to prevent hospitalization, severe illness and deaths, of course, and also to, as much as possible, decrease the transmission, but that it's unlikely that we'll be able to get to zero transmission, at least in the foreseeable future as of now. So I'll stop here and stop sharing as well and hand it over back to Donna.
Right, great. Thank you, Melanie and Wafaa. And I think a lot of Wafaa's data underscores the importance of our own vaccine mandate and the great compliance that we have had in getting our campus vaccinated. I just want to share one thing with you, and then we're going to go to some of the Q&A that we've received ahead of time. And that is that we, in addition to all of the safety requirements that Columbia has introduced, we do have one that was introduced by the mayor that you hopefully have heard about, and it's known as Executive Order 225. You can go to the next slide. So today, actually yesterday was the day that Executive Order 225 had to be enforced, although it was actually announced just about a month ago. And so if you have gone to any restaurants or to a movie theater or other entertainment venue, or you've gone to a sporting event, you may know that where you are entering an indoor facility, it is required that you are vaccinated. That is different than our requirement at Columbia, although as you'll hear, the campus has achieved into the high 90% range around persons who are vaccinated, faculty, staff, researchers, and students. Excuse me. In some cases, a very limited number of cases, individuals have been able to apply for a medical or a religious exemption. Those individuals are required to wear a mask at all time. They're also required to be tested weekly, but that's consistent with other immunization requirements that we've seen in New York State and across the country. But in the case of these indoor facilities, the mayor has said, in fact, there is no such thing as an exemption. And so the medical and religious exemptions that we have granted in very small numbers and that are reflected in your Reopen CU app as a green pass will not allow you to enter those venues. So that is indoor dining, fitness centers, as I mentioned, like the gym, and all kinds of entertainment venues. The mayor called this, it's not normally called Executive Order 225, it's called the Keys to New York City. There is an app that you can download that allows you to enter in proof of identification, driver's license, for example, or a passport, and then your vaccine information. We are asking, and I'll explain where and why we are asking that to be added to certain individuals' proof of their vaccination status. So the Reopen CU app may not, in certain circumstances, allow admission to some of our own internal Columbia facilities. So we adopted this because we were advised that we had to comply with the mayor's mandate. This doesn't apply. You may have friends who are in, Ithaca or other places. This does not apply to them. This is simply, in New York City. Excuse me. You can use multiple proof of vaccine status, your CDC card, what's called the Excelsior app, which has actually been around for close to a year now, that I happen to have on my phone, which is an official verification that you got vaccinated, but you had to have gotten vaccinated in New York State. So these are the various ways that you can demonstrate that you have been vaccinated. There's no separate, as I said, no Columbia proof of vaccination. If you got vaccinated at Columbia, that's entered into the city and the state registries. So either the Excelsior app or the New York City vaccination record that you get will in fact validate that. But we have a lot of individuals who have been vaccinated in other states. And so that this allows that information to be uploaded. You can go to the next slide. So as I said, enforcement began yesterday, and you may notice, whether you're at Joe's Coffee or you're at the gym, that there are now new signs that advise you that you must show this proof. So again, you can't go to the fitness center and use your Reopen CU app, but they will ask you for the keys to New York City, or you can even use a CDC card if you have that. In terms of the three types of facilities where this is required, this doesn't mean that for the dining facilities or even for Joe's Coffee, everything is grab and go right now. It really requires the act of indoor dining. When you go to the gym, either here on the CYMC campus or at Dodge or to any other facilities that are indoors, you must show this proof that you have actually been vaccinated. And there are a number of arts venues like Miller Theater and Wallach Art Gallery where this will be required, particularly when they're open to performances. Right now, classes are operating in some of these locations. Those are exempt from this proof of vaccination, so your Reopen CU app will work if you are simply going to classes. So a little bit of a complication and a variation in terms of our own vaccine requirement. We don't know the length of how long this is going to last with respect to the mayor, but should we switch from grab and go to more informal indoor dining, that would mean that our entire community that wants to dine would have to add this keys to New York City. So that's a little bit of an update. It happened, as I said, enforcement happened yesterday, and you may have experienced this as you've gone to some of those, more public kind of venues. And certainly, as I said, we'll be watching how long it lasts and the impact it might have on indoor sports as we go into the winter season. So that's my update, and I'm going to now turn to some of the questions that we've gotten. And I want to remind you that if we don't get to your questions or there are additional questions, the way to add those questions or comments is hr@columbia.edu. So a question about gatherings, I'll turn to Melanie. And the question is, what are the regulations for graduate students who want to gather off campus, whether it's for dining or for other purposes? Can they do that? And then also, are departments allowed to reimburse if it qualifies as a reimbursable expense?
Yeah, so again, the compact really reinforces that what we do off campus really impacts what happens on campus, and therefore it's the same guidance and the same requirements, whether it's off campus or on campus. So it's the same gathering size. So these are social events. The gathering limit is 25 individuals. Students can do that and follow the same guidance requiring masking. Obviously outdoors is preferred. And again, just consider the spaces the same as you would with an on-campus space. So if departments are looking to support any gathering for a student, be it on campus or off campus, it must follow the same guidance.
Great, thanks, Melanie. I'm going to stay with you for a couple more, so get ready.
Okay.
One is we got a question about who actually is doing the tests that we've been using on campus to test for COVID positivity.
Sure. So we've actually been using the same provider since we started our program last August, and we're using the Broad Institute up in Cambridge, Massachusetts. They set up a testing for schools program. They're actually contracted with dozens of schools across the country. They have a phenomenal program with a test that is a PCR test that is very sensitive. And we're using the same test with them. Say it is a PCR test, as you know, it's the lower nasal swab. And we send those tests up to Cambridge every day. That's the test we're using. So if you look up the Broad Institute Safe for Schools program, if you want any more information about their test, that's what we're using.
Great. And I'm going to do one more and then I'm going to leave you. And the question is, and we've gotten this quite a bit, is what's the protocol when either a student tests positive in a classroom or a faculty member or staff member tests positive in a work location? What happens and what responsibility does either the faculty member who's teaching or a unit supervisor have to inform the rest of the people who may have had contact with that individual?
So the only requirement anyone who finds out about a test has is to make sure that the contact tracing team knows about the case so we can investigate. We're then going to take care of everything else. And we actually don't want you in the workplace or in the classroom doing any sort of notification for a few reasons. Firstly, we want to protect individuals' confidentiality around their personal health information. And secondly, we want to investigate the case and make sure the information that is shared is accurate. We want to prevent sharing inaccurate information that potentially can create a lot of anxiety. So the responsibility, if you hear about a positive case, is email us at covidtesttrace@columbia.edu. Let us know the name, the uni, and if you have it, the contact telephone number of the individual who tests positive. Often when we get these notifications, we are already aware, but it certainly doesn't hurt. And that then triggers the contact tracing process. Alternately, you can let the individual know they must contact us at covidtesttrace@columbia.edu, and that will trigger contact tracing. If they've tested positive through the Broad testing program we just discussed, our testing programs here, or if they've gone to one of the student health services, we already know about that case. That triggers. Contact tracing then kicks in, and the first step of contact tracing is an extensive interview with the individual who tests positive, so we can evaluate who they came into contact with while they were considered infectious. That's why we ask no one else to do that outreach, because no one else has kind of done that evaluation to figure it out. And so people may think they were close contacts, but they're actually not, because the contact they had with the individual was not while that individual was infectious. So when that interview is complete and all that information is gathered, we then notify those close contacts. Those notifications can happen in a number of ways. If it was in a classroom, a lot of those notifications do go out by email. When they're considered higher risk close contacts, they go out by telephone. So either a telephone call or an email notification will let someone know they were a close contact. Finally, just to reinforce with this, well over 90% vaccinated population, if those individuals are close contacts and have no symptoms, they don't quarantine, they can continue to come to work or go to class. They will be given the guidance to test 3 to 5 days after that close contact. That test can happen in one of our testing centers. It can happen somewhere else if it's more convenient for the individual, but we will support that testing. And again, if they have no symptoms, they can continue coming to class. They're just asked to monitor for symptoms for 14 days after the exposure. If one of those close contacts was either unvaccinated with an approved exemption or still in the process of getting fully vaccinated, they will be required to quarantine for 10 days after the exposure. But we do take care of all the notifications.
Thank you, Melanie. Appreciate it. I'm going to turn to Wafaa. We have a question about why is it that we are mandating masking indoors if we have close to 100% of the campus vaccinated? Why aren't we just mandating that the only people that wear masks are those who have gotten some kind of an exemption, and that way we know who they are?
Yeah, I think it's a very good question. And I think the reason for this was implied in some of the slides that I showed you, which is we know that these vaccines work very well, but they don't protect 100%. There are very few things that can be 100% protective. And we have evidence that even people who are vaccinated can get infected with SARS-CoV-2 with this virus. And therefore, it's important that at a time when there is substantial transmission still, there is transmission of this virus around us, is that the reason for masking by vaccinated individuals is that in the event that they unknowingly have the infection and they're asymptomatic, because we know that vaccinated individuals tend to have less symptoms, maybe completely asymptomatic, is that then they would not transmit to others. And also we know that wearing a mask also is an added protection to the individual who is vaccinated. So I think it's for those two reasons. And because of the context of the epidemiology of COVID-19 now, that's the reason why we are requiring the added protection of indoor masking.
So Wafaa, a related question is, if we need to protect ourselves beyond the vaccine, why aren't we doing 6-foot distancing anymore?
Well, I think keep in mind that the 6-foot distancing was really, really, really important in the era before vaccines. We now are in the vaccine. Like I said, vaccines are game changers, and we have a much more powerful protective methodology, which is the vaccines, rather than physical distancing. And that's the reason why we've done away with the requirement for physical distancing, because we are have such a high level of vaccination in our community.
Great, thank you. What are you thinking about September 30th and whether face coverings will continue or will we allow them to come off?
Well, it's interesting. I showed you a lot of curves and they're all moving in the right direction. But we watch these in the public health group on a minute by minute basis. And we take into account a lot of the metrics that in our community, as in the city, as well as also, of course, in Columbia, our community. And I think we are planning to discuss several things, including, whether we continue with the indoor masking or not. And we're hoping to discuss this before the end of this month.
Great, thank you. I'm going to change the focus a little bit and turn to Gerry Rosberg. We have a number of questions about remote work and whether or not remote workers could be exempt from the vaccine mandate. That's one question, and when you answer that, I'll come back with another.
So we thought very, very hard about this question, and I understand there's an argument both ways on this. But what we concluded was that the distinctions were too hard to draw. Once you said, if you're going to somehow exempt remote workers, it gets into a very difficult situation. And we concluded that what we wanted to say was that if you are a Columbia employee, with very few exceptions, you must be vaccinated, even if you are working remotely. Now, if you're in Thailand and you're not able to get vaccinated, we're going to take that into account in deciding what to do about this. But our conclusion was that lots of Columbia people interact with the public on Columbia's behalf, doing Columbia's business, not being on campus. And we wanted to know that all of those people were vaccinated too. So it was a bigger challenge the way we did it, but we felt it was the right thing.
Great, thanks, Gerry. I have another question on remote work. And the question is, why are we not allowing employees to determine whether or not they need to return to campus? In other words, they've been doing their work on a remote basis for the last 17 months. And why is it that we're requiring them to return to work?
So the question of return to work is a very difficult one. And what we finally concluded after much discussion of this is that the right thing to do is that there are different circumstances in different settings, and that the right way to apply a policy here was to tell the schools that they have the discretion to set their own policies that make sense for them with respect to their own teams and what those people are doing. So if you're in the engineering school, or you're at SEPA, or you're at the Mailman School of Public Health, your school has put together a plan to determine who is going to come back and who is not. And the schools have somewhat different emphases because they have different responsibilities and different ways of approaching students. So there is no single answer across the board. But the one thing that everybody understood from the beginning is that it cannot be individual choice, that I get to decide where I feel like working. That would be great if we lived in a world in which every employee could decide when to work, what to do, how, but that's just not real. That we need some, this is an employment environment, and we have to have a system in place that allows the unit to make a determination of how it needs to deploy its own people. Now, if the unit, if your school tells you to come back and you don't want to, and you think there are good reasons why you shouldn't, there's a mechanism for dealing with that. Your case will be looked at on an individual basis, but it doesn't start with each employee deciding, what do I feel like doing?
Great, thank you, Gerry. And I will say, and you may have heard me say this before, that during the last 17 months, on any given day prior to the beginning of this fall semester, about 9,000 to 10,000 people have been on campus and functioning, working together. I had an in-person staff meeting today. We all wore our masks. We did, just to be safe, make sure there was a little bit of distance between us. But it was actually a joyous occasion to be able to be with your colleagues and not to be on a Zoom, where a lot of things can't be handled, require better timing. I will say it was a very lively conversation, and with a group that felt much more able to comment than we sometimes have on Zoom. So
Donna, could I go further, just given what you said? I want to just reflect the fact that I've had many conversations over the last month, and so have many other Columbia administrators, with employees who say, don't you understand how the world has changed? It's not the same. We learned so much. We learned that we could work remotely. You're still acting as if this was 1955 or something like that. That's not true either. We have changed dramatically in terms of our workforce policies. We have a tremendous amount of attention being given to what we've called the new work environment. We always had some people who work remotely. We have many, many more people working remotely now than we ever did before. It's typically not 100% remote, but lots of units where the unit has concluded that having employees work remotely 2 or 3 days a week is great. It works for the department and it's good for the employees. So it's not true that we've ignored what's happened. This place isn't run by Oscar the Grouch, even though sometimes people think it is, that we're trying to do the right thing and to strike the right balance.
Great, thanks, Gerry. I'm going to turn to David Greenberg. We have quite a few questions. I'll give you 2 to chew on, and they are about building access. And one is, how is what's called entry surfing, or I've heard it, other piggybacking, there's other ways that it has been described. How's that being addressed? And then there were some specific questions about the entrances to Mudd and Fairchild.
Well, I'll start with the piggybacking or the entrance surfing. We have in certain places, Hamilton Hall, for example, we've installed some additional card readers to help assist with some of the congestion and the piggybacking problems that we have. And also some of the, in these buildings, schools and departments have provided folks to assist as well with the entrance into buildings. But in terms of scanning people's green passes, but really at the end of the day, there's a certain amount of volume that's going to come through these buildings. And we have to remember that we are in a very controlled environment in terms of access by affiliates, and that the fact that we have very high, as you were saying, Donna, in the high 90 percentile vaccination and compliance environment. And so for the most part, for those people that happen to piggyback through, the chances of them falling into a red pass type category is very, very small. Regarding the specifics around access into MUD, I actually did see that advanced question, and within the MUD garage level, which is what we're talking about, there are card readers there. So I'm having public safety check to make sure that they're turned on appropriately. And there is one, what I would call almost secret door into Fairchild, that first you have to get into the Grove and then into the parking garage because you have parking permit access, and then know where this door is. There is one door that doesn't have a reader that's primarily an exit door that we'll look at. But the number of people who use that are very, very small. And so in terms of general public access to that specific door, it's very small, and we'll be taking care of that now.
So Donna, are we permitted as panelists to volunteer to answer a question? Is that
I would
a violation of the
absolutely
rules?
like you to add on. I was going to, but please do it.
Okay. I wanted to come back to the last part of what David said about piggyback, because I agree with exactly what he said. I just want to amplify it a little bit. I think the people who are concerned about piggybacking or sneaking in or whatever, I think it's not just their sense of order and fair play. It's not like line jumping and it offends them that it's happening. They think it's a vulnerability in our whole enforcement system, and that our claim to be a fully vaccinated campus may be in jeopardy because people are doing that. And that's just not true. That's a misunderstanding of how this whole system operates. And that's for two reasons. And David touched on this, so I just wanted to do it a little bit more detail. Reason number one is that nobody, especially not students, they don't swipe into just one place. You have to swipe over and over again over the course of a day. So you may piggyback once, you may even piggyback 10 times over the course of the day, but very few people can get through a whole day without swiping in someplace. And if you swipe in any place over the course of a day, we will know that you did, and we will determine that someone, if you are unvaccinated, was on campus and didn't swipe in. So then I hear you say, but if I'm unvaccinated, I'm going to be that very clever person who never swipes in. I will piggyback everywhere I go. I might even find a pal who is, like, you can imagine all sorts of things. And I'm telling you, that won't work either, because we know who every student is. And our compliance efforts aren't just focused on those who are swiping in. Of course, that's a high priority, but we're focused on everybody. And if there are students out there who are not vaccinated, even if they never swipe in, they're going to get a visit from us. So what you need to assume is if you see somebody piggybacking into a building, be mad at them, or maybe not be mad at them because maybe they're just late for class and they're trying to get through a door quickly. But whatever you think is going on there, that student is almost certainly vaccinated. 99+% that student is vaccinated.
Thanks, Gerry. And I want to add one thing, and then maybe Julie. I positioned myself outside one of the buildings today, and I encountered about 35 to 40 students who were entering the building. Sometimes the door swings open and people just walk in naturally. Sometimes someone holds the door because they're trying to be polite. This is not as though there's a conspiracy out there of piggybackers, so to speak, not to mention that for our undergraduate students who are living on campus, they can't get into the dorm without being, first of all, they weren't allowed to move into the dorm until we saw that they had a vaccine. And secondly, there's a lot of security there. But Julie, you might want to comment as well around what will ultimately have the ultimate penalty to the student who is not vaccinated.
Right, so we are going to deregister the students, and they will be de-enrolled in their academic programs if they're not compliant with the vaccine mandate. We're working really closely with CU Health right now and each school, and we have a list of every student that was expected to arrive this fall and has not had their vaccine information uploaded or been in communication with their school about a delay in arrival or something in a unique situation. And in those cases, we're putting together a list, and those students will be notified that if we don't hear from them within 24 hours, they will be de-registered or de-enrolled from their academic program. So, ultimately, they will no longer be able to attend class from a registration perspective, and that's part of our compact in terms of ensuring that everybody who attends class, just like everybody who comes to work, is vaccinated.
Great, thanks, Julie. I'm going to turn to Melanie, and actually, one of the questions that we had was, why is it that we're only reporting the testing results for our asymptomatic individuals? It's actually not true. I'll let Melanie describe what we do report. If you remember that first slide that she showed, which was a clip from our COVID-19 website.
Sure. So we actually do some pretty detailed reporting, and there's even more behind the first screen on the dashboard. So what you'll see when I share the percentage positivity rates, that is true. That is based on the tests that are done through our testing centers. But we know that not everyone tests for our centers. Obviously, if symptomatic, they go elsewhere for testing. So we do include that complete number on the same table. Obviously, we can't put that as a percentage because we don't have a denominator. So we just give the number of cases reporting. If you want to add them up, you could certainly add up both those numbers. But again, we cannot provide a denominator because we don't know how many people were tested. That's why it's important to separate out those numbers. And also there's additional detail. If you want the breakdowns per campus, you can see that on the website as well. But it is further down on the clip that I shared on the website.
Great, thank you. Melanie, we do have a question about what percentage of the Columbia community, faculty, staff, researchers, and students has gotten a vaccine exemption.
I like to use Gerry's term that it's close to a rounding error. These numbers are minuscule, and I believe at less than 1% of our total population. The numbers are really, really tiny. So when we talk about being a fully vaccinated community, we truly are. It's not like there's 10 or 20% who received exemptions. The numbers are really tiny.
Great. Julie, we have been asked also, is it possible to provide that information of the number of exemptions by school or by department?
Melanie, it's actually more of a CU Health
Okay.
question. I know we're not providing individual information on
That's correct.
about who's vaccinated or not. So I don't believe so.
No, and I would add to that, the reason is because I've just shared, these numbers are so tiny. Again, we are trying to keep information confidential. This is people's personal and private health or religious information that is highly confidential. Because the numbers are so small, if we said X department has one individual, they may be able to identify who that individual is, and that would not be appropriate. So when we're keeping these, as I say, across the university, and these are not, these are not all consolidated in one tiny corner of the university. It truly is spread across our institution in very small numbers.
And I think knowledge of this information would not make any difference. And that's, I think, is the important thing for people to appreciate.
Yeah. I hope before too much longer, we will be able to get out some aggregate numbers, because I don't think these numbers should be needed to understand what we're doing. But I understand that there is this pressure for them. I certainly agree that we can't do it school by school. But I think under any reasonable standard, if all of the exempt people were in one school, it still wouldn't be a problem because the total number is so small.
Great, thank you.
Remember, people are vaccinated and you're wearing a mask and all the other restrictions and gathering and visitors and all of this. It's a comprehensive package of protections that we have put in place.
Yeah, I would say too, there are many people who complain that we are too restrictive. So we get it from multiple sides. I think when we look at our Ivy League peers, We actually are on the conservative side of being more restrictive, whether, as Wafaa said, it's about gathering sizes and other, in particular, large events that some schools are allowing to occur, including even things like student travel abroad, which, we have not allowed during this fall. David, I have a question about the Studebaker building, and could you address that? The question is have there been any updates and upgrading of the air filtrations in Studebaker?
Yes. The Studebaker building has undergone the same building check as all the buildings on campus, in fact, twice over. Studebaker building has 12 central air handling units, all of which have been upgraded to MERV 13 rating, which is the recommended rating for filtration for removing virus transition from the air. And the building has been basically in full service the whole time and occupied. It's more occupied now than it has been over the last year, but yes, it is fully up to speed.
Great, thank you. There's one question we got that I'll answer, and then I think we're gonna, I have a couple more that we'll get into before we have to wrap up. And that is, given how closely we are integrated into the urban environment, what have we done to try to support the community? One very simple thing that we've done is by creating the compact, which asks our students and our faculty and staff to adhere to the same kind of guidelines when they're off campus and frequently in adjacent, whether it's restaurants or other spaces. We actually ask them to adhere to the compact, and which means, face covering and previously physical distancing. And we also encourage reporting of those kinds of potential violations. If you see a group of Columbia students in an indoor venue and no face coverings and perhaps maybe some outrageous behavior, we ask that be reported. We also, as you know, since the beginning of the availability of the vaccine, have been doing vaccinations for the community up here on the medical center campus. And so we are open to support the community through administration of the vaccine, including the new boosters, and in doing testing in some of our Columbia doctors' buildings for anybody who wants to come in and be a patient. So those are a couple of the ways that we are supporting the community and hopefully trying to also reopen some of our spaces as we go forward and it's safe to do so. I don't know, Wafaa, if you want to add anything else about community work that you're doing through ICAP that I think is supporting what we have to accomplish in this COVID pandemic.
Yes, and I think not just ourselves at ICAP, but also several other people as well at various schools, both here at the Uptown campus as well as also the downtown campuses, are very engaged. Several are conducting studies of new vaccines, for example, and new treatments and preventive measures for COVID-19, conducting surveys that try to get at the impact of COVID-19 on various members of our community. We just completed a survey amongst older New Yorkers living at home, 70 years and older, to get a sense of the impact of COVID on their lives and also how we can respond to their needs. Another survey is being conducted now amongst LGBTQ community members in New York. Again, all of this as part of the effort to try to respond to the needs of our communities.
Thank you, Wafaa. Julie, just another classroom question with respect to what faculty can do in the classroom. I know some of this is addressed on the COVID-19 website, FAQs for faculty, but we did get a question about what can a faculty member do if a student isn't masking, and how can they ensure compliance going forward?
Yeah, so we've gotten that question quite a bit. I think, faculty should, we are all expected as members of the Columbia community to comply with the Columbia Compact, and that includes wearing a face mask indoors. So faculty should tell the student that they need to wear a mask. They should also feel free to correct somebody who may be wearing a mask incorrectly, not covering their nose and mouth fully, etc. And if the person refuses to comply, they should ask the student to leave the classroom and in fact leave campus. I will say we haven't had much resistance. Typically when faculty members or students peer-to-peer note that somebody's wearing a mask incorrectly or has forgotten to put it on, they note it and the student has complied. So we haven't actually had resistance or confrontations around this issue, but it is important, I think, that everybody in the classroom is compliant and that the faculty member plays a role as well as the students in the classroom. We do have, and I think it's been posted in the chat, you can report an incident if a student is refusing to wear a mask and you want to report that incident, you certainly should. But again, I think in most cases, asking them to wear a mask is sufficient. I will say, Donna, if I can take one more second, and we've had questions about what kinds of masks to wear, and we've even heard situations where faculty have asked for all the students to wear an N95 mask. And just to be clear, that's not necessary, it's not required. We want everybody to wear, and they can wear a surgical mask, they can wear an N95, a K95, they can wear any kind of a two-ply mask on their face. And so there are no specific mask requirements, and they should not be conveyed in any situation, either in the workplace or the classroom.
Great, thank you. Maybe just one last comment from you, Julie, along this line is, what are the best practices for a faculty member when a student advises them that they either have tested positive and they may not disclose that, they may just disclose, I'm going to be out of class for a period of time. What are the best practices that a faculty member should be employing?
So I think the most important thing, and I think Melanie said this earlier, is that if a student emails a faculty member that they've tested positive, is just to reinforce that they need to report that. And I think, again, the website is there because we need to make sure that that information is given to our contact tracers so that they can do their work. And that's really the most important role that a faculty member should play. Beyond that, there is no need for a faculty member to communicate anything about the health and safety of the classroom, about who should or shouldn't come to class, any other aspect of it, that is going to come from the contact tracers. We don't want faculty to play a role answering questions about health. If a student emails the faculty member or asks a question about they're not feeling well and they're not sure what to do, they should refer that student to student health. They should refer that student to their own medical provider. So, we don't want faculty to feel like they are in a position to respond and manage the health of their classroom or of their community. So we have the systems in place, and the most important thing people can do is make sure that if somebody does test positive, particularly if they've tested positive outside of our testing system, that they let the contact tracing know, and that those systems will then kick into action and work, and all that communication will be managed by CU Health.
Great.
And just a reminder that, of course, that the instructor should not disclose the name, the identity of that individual.
Right. So thanks to all of the panelists, and thank you for your questions in advance. And again, HR email at columbia.edu. But many of the questions, we got some questions about visitors that I skipped. There are some very detailed guidelines around visitors, around events, and so forth. So I encourage you to do that. We are playing it by ear in terms of our next webinar. I want to see what conditions develop. I also didn't tackle some of the booster shot questions because other than this group that has been very limited and was announced by the CDC and the president, we are not aware of any other guidance on booster shots. So more to come on that and some of the other post September 30th conditions. So we hope to see you soon, and thanks to the panelists and to everyone else for participating.
Thank you.